Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and good morning everyone. Today we will learn aging population in Malaysia in conjunction of World Statistics Day and National Statistics Day on 20th of October. Let's start right now. Today's presentation will comprise of 6 parts: introduction, current scenario, causes and effect population aging, solution and recommendation, MyCENSUS 2020, and conclusion. For introduction on aging population, firstly, let's proceed what is meant by population aging and the definition itself. Basically, anybody who is reaching 60 years and above is considered to be old aging, so population aging occurred when older people are a greater percentage of the population. When this happens, the average age of the population also getting older. Meanwhile, the ratio of older people to younger people also increases. Next, we move deeper to the definition of population aging by several occasions. In 1982, World Assembly of Aging in Vienna defined an old aging as an individual who is 60 years old and above. Based on a WHO, World Health Organization, any countries will be an aging society when its people are of 60 years old and above, reaching to 10% of the total population. Based on United Nations, aging is comprises of 3 categories. There are aging society when people of 60 years old and above reaching to 7% of the total population. Aged society when people of 65 years old and above reaching to 14% of the total population. Super aged society when people of 65 years old and above reaching to 20% of the total population. Based on Dasar Warga Emas Negara, DOSM, aged society occurs when the percentage of 60 years and above people reaching to 15% of the total population. Basically, we know that population around the world are getting older. The number of people aged 60 years or older will rise from 900 million to 2 billion between 2015 and 2050, moving from 12% to 22% of the total global population. These two maps shows how population are changing in different countries around the world. Some regions, North America, parts of Europe, and some parts of Asia will have 30% or more population 60 years or older. Regional comparison based on the data from UN DESA, the number of 65 years and above people in 2019 over the world is 702.9 millions, while in 2050 there are 1,589.9 millions of 65 age person in the world. This shows significant increment over the 30 years difference. Population aging. We also know that population aging is happening much more quickly than the past. For example, while France had almost 150 years to adapt to change from 10% to 20% in the proportion of the population that was older than 60 years, places such as Brazil, China, and India will have slightly more than 20 years to make the same adaptation. There are 2 key drivers of population aging. The first is falling fertility rates, and the second one is people living longer overall. From the slide, we can see the current scenario. Demographic transition Malaysia 1911 to 2020 estimate. Demographic transition in Malaysia through 3 phases. The first phase, 1911 to 1921, the crude death rate (CDR) was higher than the crude birth rate, while the population of 1920 was only 2.9 million. The second phase in 1922 to 1957 showed a positive development when the birth rate exceeded the mortality rate. The birth rate in 1957 was 46.2 and the death rate was 12.4, with the total population during the independence was 6.3 million. The third phase from 1958 to present shows birth rate start to decline while mortality rates start to stabilize. The population in 2020 estimate was 32.7 million, 5 times more as compared to 1957, with birth rate of 2018 15.5 rates per thousand population and 5.3 deaths per thousand population. Current scenario in Malaysia. Based on the slide, this shows several current scenarios that relates to the population aging in Malaysia. Population aging can be defined as the demographic transition of high birth rate and death rate towards a lower rate as the country moves away from the pre-industrial, agriculture-based economy to industrial economy system. This phenomenon is caused by lower birth rate and decreasing total fertility rate as well as increasing life expectancy. As a result, changes would occur in the social structure and increasing need for long-term healthcare. There would also be uncertainty in economic growth and potential. Now we can see the population pyramid of Malaysia starting from 1970 until 2040. In 1970, only 5.4% of the population aged 60 years and over, 44.5% of the population aged 14 years and below. However, in 2018, only 23.9% of population is 14 years old and younger, while 10.3% of the population aged 60 years and over. By 2040, there will be 5 older person 60 years and over from every 20 Malaysians. Now we can see the population pyramid of Malaysia starting from 1970 until 2040. In 1970, only 5.4% of the population aged 60 years and over, 44.5% of the population aged 14 years and below. However, in 2018, only 23.9% of population is 14 years old and younger, while 10.3% of the population aged 60 years and over. By 2040, there will be 5 older person 60 years and over from every 20 Malaysians. Aging nation in Malaysia. According to Dasar Warga Emas, Tuan will be labelled as an aged nation when more than 15% of the population is aged 60 years and above. As for 2020, Malaysia has 10.7% population aged 60 years people. This situation keeps increasing every year, and by 2030, Malaysia will be labelled as an aging nation because 15.3% of the population is 60 years plus. According to the United Nations, Malaysia is expected to become aging society in 2020 when the population of 65 and above 7.2%, aged society in 2039 when the population of 60 years and above 14.1%, super aged society in 2050 when the population of 60 years and above is 19.9%. Based on the Dasar Warga Emas, Malaysia will becoming an aging in 2030, in which 15.3% of the population is 60 years and above. State comparison for age 60 and above. Top 3 states for the 60 and above are as follows. You can see Perak 15.8% already reached the aged society, Perlis 13.8%, Pulau Pinang 13.5%. Top 3 states for age 65 and above are as follows. Perak 11%, Perlis 9.4%, Pulau Pinang 9%. Okay, this slide shows the comparison for age 60 and 65 years above by district in Malaysia. We can see Timur Laut, Pulau Pinang is top of district by 18.5% and 12.9% respectively for 65 years and above. Main age group of population 2020. In 2020, Malaysia age group of population is 23.3%, population between 10 to 14 years old, 69.7% population between 15 to 64 years, and 7% population 65 years old and above. Let's move to causes and effect of aging population. Silver tsunami. According to the United Nations, in their publication of Aging in 21st Century 2015, an aging population refers to a phenomenon in which older individuals become a proportionately larger share of the total population due to declining fertility and increasing life expectancy. The growth of the older population, age 65 and above, is over the most significant demographic trends all over the world. Causes of population aging. The first one, lower birth rate and declining total fertility, the TFR. Good birth rate have declined from 32.4 in 1970 to 15.5 per 1,000 people in 2018. TFR declined from 4.9 babies per woman in 1970 to 1.8 in 2018, which is below the replacement level of 2.1. Next, increasing life expectancy. Life expectancy at birth have risen from 61.6 years in 1970 to 74.9 years in 2020. Lisday et al. 2014 stated that increasing life expectancy in the last 20 years is due to control of infection disease, abundance and safer foods, better sanitary conditions, and other non-medical social improvement. In high-level countries, avoidable male mortality has fallen since 1980 because of decrease in avoidable cardiovascular death by mother. From the above diagram, we can see that there is a relationship between indicators that connect aging with its effects. It is important for us to be able to understand what indicators such as fertility and life expectancy are indicative of, which can assess the effect and consequently take reasonable measures to address the negative effects of the current age structure changes in population. The impact of aging, we can see from here, there are three main impacts on the aging population: impact on healthcare, impact the social structure, then impact on the economy. Silver tsunami is a metaphor of the situation that we are facing right now in Malaysia, which is a population aging. It refers specifically to the healthcare and socio-economic implication of aging population. Aging population is a global issue faced by all developed and developing countries. Impact on healthcare. Increased demand for long-term geriatric healthcare. Current healthcare systems are not well suited for treating age-related symptoms. Increase in government expenditure for healthcare and rehabilitation. Lack of the access to excellent geriatric healthcare and support system in rural area. The next impact on social structure. The next impact is on social structure. Increase in dependency ratio, which is the measure showing the ratio of the number of dependents aged 0 to 14 and over the age of 65 to the total population aged 15 to 64. In 2010, dependency ratio was 47.8, while it is projected to rise to 49.5 in 2040. Dependency of younger family members for long-term care. Increase of income inequality and poverty among elderly population. Impact on economy. Decreasing workforce to sustain growing economy. It is estimated that the average Malaysian need to save at least RM20,000 in retirement saving to sustain high living standard after retirement. This is due to increase the life expectancy overall. According to the NST Gen 11, for retiree to be able to spend at least RM800 a month for the next 2 decades until he reaches 75, he must at least have RM196K or RM200K. Only about 1/5 of the EPF contributors who retires that year have that much money in their saving in said Syariah. Solution and recommendation. Basically, the current initiative, as shows in the slide, we do have a pusat aktiviti warga emas, Unit Penyayang Warga Emas, UPBE, Dasar Warga Emas Negara 2011 and Plan Tindakan Warga Emas Negara 2011. Besides, Jabatan Kebajikan Masyarakat and NGOs also have their commitment to make a current initiative for all the people for aging nation. And then Dasar Kesihatan Warga Emas Negara. Currently, 51 pusat aktiviti warga emas located throughout the country to organize activities and provide socialization platform for older persons. Unit Penyayang Warga Emas is a transportation service to shuttle older person to hospital clinic operated by Jabatan Kebajikan Masyarakat. From 2018 until December 2016, this service has benefited 70,480 older persons. Currently, there are 9 government-run retirement homes, Rumah Seri Kenangan RSK, an average of 1,800 residents have benefited from the service at any time. There are currently 310 private elderly care centres in Malaysia. We learn from best practice from other countries. That we can see for Japan, they have long-term care insurance and are public and made mandatory by the government. It is one of the most generous long-term care systems in the world in terms of coverage and benefit. In Europe, the focus is on investing in research and education to boost the economy while receiving and integrating migrants into Europe to counter the dwindling young labour force. International migration was not a popular policy in Japan due to the deeply conservative Eastern culture. World Health Organization (WHO) helps oversee and advise all policymakers internationally on the best aging policy to implement. Their focus are to develop age-friendly environment, alignment healthcare needs to older population, develop sustainable long-term healthcare system. For the recommendation for Malaysia, LD population are as follows. We can see that cash and tax incentive encourage early marriage among youth and for financially able to whom to have more children, increase retirement age to improve labour participation rate for women, design education system to prepare for innovative, multi-skilled and highly adaptable workforce. Encourage household to increase retirement saving, especially for women since they have higher life expectancy. Improve long-term healthcare policy and infrastructure for elderly population. Promote volunteerism among the elderly to improve social engagement, physical health and mental faculty. For MyCENSUS 2020, sources of aging population data, where we can get the data for the population aging. Detailed aging population data Malaysia are obtained through the Population and Housing Census or MyCENSUS held every 10 years. The census data is supported by more frequently survey. Only through MyCENSUS, demographic and detailed information of senior citizen obtained. The data collected will be used by policymakers to formulate benefit plans and care for the elderly in Malaysia. In the questionnaire for MyCENSUS 2020, which is related to the senior citizen, to identify the level of well-being of the elderly, question related to regular activities, sources of income, the presence of children living nearby, and the emotional situation experienced are included in the 2020 census question, which is question 11. Frequently activity performed by senior citizens in Malaysia, which include activities as shown in the slide. And then question 12, sources of income for the elderly. Question 13, children living nearby. Question 14. Situation experienced by the elderly population in Malaysia. To conclude my presentation this morning, the conclusion for the aging population, we have to focus on developing an elderly population, maintaining functional ability that also enable general well-being. Priority to ensure our elderly population live a healthy and fulfilling life while sustainably growing our nation towards a greater height. Population policy on the elderly needs to be segregated into short-term and long-term development. Recommendation that under the next Malaysia Plan, development program need to focus on monitoring specific needs of the aged, especially for citizens aged 60 years and above. Here we include infographic for Hari Warga Emas, which happen on the every 1st of October. Currently in Malaysia, we have 3.5 million, which is 10.7 people, which is 60 years and above. That's all from me on aging population. Don't forget, 20th October is World Statistics Day. Better data, better life, and make sure you are counted in MyCENSUS 2020. Thank you.